Hello, and welcome to the next session of these studies. We are on the fourth principle of pharmacokinetic, which is excretion or elimination. And this principle is basically the process by which drugs are eliminated or removed from the body. Now, since we know that metabolism gives us metabolite and some of the products also go unmetabolized or unchanged, then we know that the product that can be eliminated will either be a metabolite, an active or inactive form, or an unchanged drug. Therefore, elimination is basically the removal of such metabolites or unchanged drugs from the body. Again, we have stated and noted that drugs are foreign agents or foreign molecules, and the body, by all means, must remove it from the system. And elimination is the pharmacokinetic process by which this occurs. Again, remember, pharmacokinetic is what the body is doing to the drug. So how is the body able to remove these drugs? So there are various routes by which our drugs can be eliminated. These routes are all important, but because we said the primary way of elimination, the majority of the drugs will be eliminated through the renal or the kidney system, we'll be focusing more on the kidney system. However, it's important to note that when it comes to elimination, even though the kidney is doing majority of the elimination, there are other parts of the body where elimination can occur. And if we look at our picture here, we see the kidney giving us the majority of elimination, the liver, which works sometimes to send to the kidney, sometimes to send through the GI tract. The liver itself can also be an organ of elimination. The lungs, breast milk, the sweat through the skin, even the saliva, can all be means by which drugs can be eliminated. And I'm sure you probably have had an experience where you took a certain drug and you could smell it in your breath, or you were told as a pregnant woman or a lactating mother not to give certain drugs or take certain drugs because it could be found in your breast milk. So various routes, but we will be focusing on the renal excretion, the kidney, because that is where majority of our drugs are eliminated. Now, again, we stated that the reason for metabolism is so that the drug can become polar for elimination or more water soluble for elimination. So in this case, the reason why metabolism occurs is to promote the kidney from eliminating the drugs. So here is a typical example. So now most drugs, for them to be able to enter into the body, usually are lipophilic, lipid soluble. So here is an example of a drug which is lipophilic. Now, if the drug has not undergone metabolism and it gets to the kidney, it will be reabsorbed, so the drug will be retained, meaning it will not be eliminated. Why? Because it is still lipophilic in nature. It will not be eliminated. It will be reabsorbed and enter back into circulation. And that is why, to avoid this from happening, this is why you have the liver doing the biotransformation processes. Phase 1, phase 2 processes we discussed. So we have the liver transforming the drug from a lipophilic agent into a hydrophilic agent, from a lipid-soluble agent to a water-soluble agent. And once it has gone through that process, then that drug has a chance of being eliminated. And for drugs that will pass through the liver unchanged, it simply means they are hydrophilic enough to be eliminated from the body. So it's important to note that the major characteristics of compounds that are readily eliminated by the kidney are that they are polarized, they are charged, or they are water-soluble. Lipid-soluble drugs do not easily get eliminated by the kidney. Such drugs must go through the phase 1, phase 2 biotransformation process of the liver so that it can have an increased water solubility and the possibility of being eliminated by the kidney. Here are some factors that may affect the elimination of drugs. Like the others that we've discussed, we will look at it in drug factors and then the host factors. If you look at the drug factors, of course, the nature and characteristics of the drugs. So a drug that is lipid soluble must be converted to water soluble for it to be eliminated. Therefore, lipid soluble drugs delay drug excretion. The volume of distribution. Drugs that are more distributed into tissues stay longer in the body because of the distribution. It is free drugs that can be eliminated. Those that are bound must be released from the binding, whether to protein or to adipose or to whatever tissue it is bounded to. So the higher the binding ability, the higher the volume of distribution, the slower our excretion. The weight of your molecule, higher molecules find, high molecular molecules may find difficulty being filtered at the glomerula, and small molecular molecules can easily be eliminated. Drugs that have more affinity for binding are also drugs that may find it difficult. For protein binding, will find it more difficult to be eliminated because it is bounded to protein, and unless it is a free form, it will not be eliminated. And when we talk about the host factors, a disease state, and since we are interested more in the kidney, any kidney disease, especially, will be affecting drug elimination. So pyelonephritis, kidney function, or poor kidney function, kidney failure, all of these will affect drug elimination. Other conditions like hypertension and diabetes will also affect drug elimination. The pH of the urine, depending on the nature of the drug, a more acidic drug. So we say drugs usually come as weak acid or weak bases. A more acidic drug may be neutralized in a higher pH environment, and vice versa. A less acidic drug, a more basic drug, may be neutralized in a lower pH environment. So the pH of your environment will affect the drug depending on the nature of the drug. How quickly urine is flowing may also affect that. For example, we know in pregnant women, urine flow may increase, and people who are having challenges with their kidney may also have urine flow increase. An increase in urine flow may also affect your elimination. By the same way, a decrease will also affect your elimination. Now, age, children, infants, and the elderly especially have lower capacity of elimination. Children, because their kidney is not well developed. Elderly, because it is compromised by reason of whatever reason. It's compromised, and that can affect our drug elimination. Blood flow through the renal site. A higher blood flow, that means the higher the filtration we will have, and that can also affect our elimination. And there are certain drugs that may also compete with your drug for elimination at the kidney side. So may either increase, promote, or decrease elimination. So it means that certain drugs, when you use drugs together with certain drugs, that could also affect your elimination of drugs. So that is all the 4 principles that are associated with pharmacokinetics. We can simply call this ADME, absorption, distribution, metabolism, and elimination. Now, this is what we call the pharmacokinetic graph. Now, in this graph, we are trying to see how drugs are being affected by your body. So if we start at time zero, here we notice that at time zero, since we haven't given the drug, the concentration of the drug is zero and the time is also zero. But when we give the drug, as time progresses, we see the drug entering into circulation or entering into the blood. This is what we're calling the plasma concentration. So as time flows, you see the drug going into the plasma or into the blood. This is by absorption. The only way the drug can get into the blood, we said, is by absorption, the movement of the drug for wherever we administer it until it gets into the bloodstream. So that's the absorption process. Now, we can have a maximum absorption, which becomes our peak height, and then we reach a point where the rate of absorption becomes equal to the rate of elimination. Elimination is where we are getting rid of the drug. In this initial state, the rate of absorption is higher than the rate of elimination, so we see a steady climb. Then, as we reach a plateau where the rate of absorption equals the rate of elimination, we have this peak. Then the rate of elimination exceeds the rate of absorption, and we see the decline of the drug. Now, why is this important? And under this, we have the volume of distribution, or the area under the curve. This is how the drug is being distributed through the system. Once it has been absorbed, it's going to be distributed in the body, and then it's going to be eliminated. Now, why is this important? Every individual drug has a minimum concentration by which the drug becomes effective. This is the minimum effective concentration. We depend on the absorption to get us to the minimum effective concentration. So from time zero until we reach this minimum effective concentration, the drug is subtherapeutic. The drug is lower, the concentration is low to give you the therapeutic effect you are looking for. So every drug may have this time delay. This is also the reason why oral drugs, in fact, all different routes of drugs have different time rates to reach their minimum effective concentration. Fortunately, IV puts us directly, because IV automatically does not have absorption, directly puts us into the concentration that we are interested in. It's also possible for drugs to go beyond the maximum of your effective concentration, where you reach the toxic concentration level, where after this level, the drug usually becomes toxic to the body. So for us, when you are giving a drug, we are interested in keeping the drug within the minimum effective concentration and the toxic concentration. This window is what we call the therapeutic index, and every drug has its own therapeutic index. Some are narrower, some are wider. The more wider the drug is, the less tendency of having toxicity, and the more narrower the therapeutic range is, the higher the tendency of having toxicity with the use of drugs, and therefore the need to monitor for such drugs. Now, this is a single dose of the drug, and we know that from this example, around the 6th hour or so, the 5.5 hours, the drug will come back to elimination, would have removed most of the drug, and we are down to the minimum again. So as a good practitioner, as a good medical person, you know that you have to put in the drug again so that you can have the drug absorption, bringing in the drug. By the time the first dose have reached the minimum, you should have your second dose reaching this therapeutic range. Therefore, we will have a series of curves, a series of these curves, and we are told that usually 5th or so, 4th, 5th or 6th concentration or dose will lead us into what is referred to as the steady state concentration. And when we say steady state concentration, we are talking about the concentration where the absorption and the elimination rates are the same, and therefore you have the drug plateauing as a flat line in the therapeutic range. That is what we're looking forward for, and that is why we keep repeating the doses. Because each drug is unique and different, you will notice that we will have different doses and dosage regime in different times. Some 8 hourly, 4 hourly, 3 hourly, and whatever period we are giving, it all depends on this pharmacokinetic property and care. So we have to do the care for every drug so that we will know how to dose the drug, we will know how to change the concentration, we will know when we will get into toxicity. So for example, we know you give 100 milligrams, you will stay within the therapeutic dose. You give 300 milligrams, you will go above the toxic concentration. And that is why you will see that they tell you this is the maximum of this drug and this is the minimum of this drug. All aimed at keeping the drug within the therapeutic range or the therapeutic window so that we minimize toxicity and we improve efficacy. So this is why we had to study pharmacokinetic and we had to understand what the body is doing to the drug. The next time we meet, we are going to use the same principle and look at what the drug is doing to the body, which is pharmacodynamics. All right, thank you very much for your time. Don't forget to subscribe for the channel so that whenever we have new things, you can be notified. Have a wonderful rest of the day. God bless.